Hi, my name's Issa Ortman. I'm from the School of Integrative Physiology and Athletic Training from the University of Montana. Our research was on the influence of patient position during mechanical traction on lumbar mobility, and my co-presenter Kevin will get us started on the background.
Hi, I'm Kevin Garifi. I'm going to give a little background on our study. Traction is a prevalent modality used to treat spinal disorders. Approximately 40% of the adult population is affected by low back pain within a 1-month time frame. Lumbar traction is used in about 20% of the treatment plans for these individuals. The most seen method in practice is mechanical traction on a split table, which we use in our study. Mechanical traction uses a motorized device to apply a selected traction force to slowly elongate the spine. One of the ways it reduces pain is through the lengthening of tissues and ligaments. Past research has demonstrated the ability of sustained distraction forces to increase the length of spinal tissues by creep and hysteresis. Increased length can result in increased spinal movement either overall or between each vertebra. In our research, we aim to quantify this increased spinal motion specifically in the lumbar region and to compare the change induced by 3 different positions of mechanical lumbar traction: 90-90, prone, and supine.
Next, I'm going to talk about the significance of our research. We found in previous research that it can help with pain management and increasing intervertebral disc height. We also found in one study that low back pain can be secondary to restrictions in spinal mobility, and restriction in lateral flexion is associated with an increased risk of developing low back pain. Another study, we found that limited lumbar extension range of motion was determined as a clinical predictor of short-term improvement from mechanical lumbar traction. However, the gap in the literature is that we did not find any research on traction and lumbar mobility specifically. The purpose of our research is to compare the effects of supine, prone, and 90-90 mechanical traction on lumbar mobility. Our hypothesis was that our participants' lumbar mobility would increase the most after 90-90 traction. For our research, we used a convenient sample of 4 healthy adults, 2 females and 2 males. We used a repeated measures design to complete 3 separate trials with a week between each trial. The 3 trials included 3 separate lumbar mechanical traction treatments in either a supine, prone, or 90-90 position for 15 minutes. All patients obtained a traction force of 50% body weight with a continuous pull. Range of motion was measured using a standard 12-inch goniometer before and after each trial. The lumbar flexion and extension was measured with the axis on the greater trochanter, the stationary arm perpendicular to the floor, and the moving arm following the mid-axillary line. The lumbar right and left lateral flexion was measured with the axis on the S1 spinous process, the stationary arm perpendicular to the floor, and the moving arm pointing towards the C7 vertebra. 3 measurements were obtained for each range of motion, and an average was recorded. Treatments were then randomized and spaced out at least a week apart, and we used Microsoft Excel to calculate descriptive statistics. A separate 2x3 repeated measures ANOVA was used to calculate the mean differences. The significance was set to a set priority of p equals 0.05. Our results showed a 2x3 repeated measures ANOVA revealed no statistical significance between patient positions during traction. The main effect for time was noted for lumbar extension, where further analysis revealed a significant difference between the supine and 90-90 position. However, a trend for improved lumbar range of motion was noted across all 3 positions after receiving mechanical traction. Here are our 4 visual representations of our results. There's one graph for each lumbar range of motion. As you can see, the differences between each position is minimal. In the lumbar extension graph, we do see the significant difference between 90-90, which is the red line, and the supine, which is the black line. Throughout all graphs, you can see a trend for improved lumbar range of motion after receiving mechanical lumbar traction, regardless of patient position.
In conclusion, the hypothesis that our participants' lumbar mobility would increase the most after 90-90 position was not supported. The primary finding of our study was a trend of increased lumbar range of motion following mechanical traction, regardless of position. A statistically significant improvement in lumbar extension was seen but a large standard deviation in this measurement adds caution to clinical interpretation. Some limitations of our study were a small homogeneous sample and the lack of repeated post-treatment measurements to observe lasting effects of traction. Additional research is needed to support the clinical use of traction to improve lumbar range of motion absent of symptomatic lumbar pathology.